Good morning. I have an exciting weekly video for you today. It's compliance training and specifically the 99203 new patient code. Now, compliance training has 7 components, and this is one of the components in that quote from the OIG report, conducting appropriate training and education on practice standards and procedures. So this video is going to cover some training on the code 99203, which is of course a new patient code, and the detailed new patient code. Of course, new patient codes range from 99201, 202, 203, 204, and 205, and they have specific components, and this is the most commonly used code for new patients, so that's why we're covering it. So the general requirements of the 99203 have 3 key components. 3 of 3 are required. Number 1 is a detailed history. Number 2, a detailed examination. And medical decision making of low complexity. And again, all 3 of these are required, but there are subcomponents of each one of those that will satisfy a detailed history, a detailed examination, or medical decision making rated as low complexity. So first, let's talk about the history requirements. It requires a chief complaint, an extended history of present illness consisting of 4 elements, an extended review of systems requiring at least 2 review of systems, and a pertinent past family and social history, which is at least 1 element from any component of past family and social history. Some examples of chief complaint would be just the chief complaint that they are presenting with. The extended history of present illness consisting of 4 elements would be your OPPQRST, onset, provocative components, in other words, what makes it worse, palliative, what makes it better, the quality of the pain, does the pain radiate, the severity of the pain, and then the timing of the pain. So you need at least 4 of those, which should be pretty easy to achieve. And then review of systems, we need at least 2 review of systems, such as a musculoskeletal review and a neurological review. It could be any of the systems, and we'll cover which systems are included in this list a few slides down. And then we have pertinent past family and social history, at least 1 element from any of that. So that could be their occupation, whether or not they exercise, any family history that could be pertinent, so on and so forth. It should be pretty easy to achieve at least 1 element from the past family and social history. For the next video, we're going to talk about detailed exam requirements. This is where the 99203 gets a little bit more complicated, and we're going to split this up into another video because it's going to take a little bit more time, and I want to keep these videos relatively short and sweet. So for this week, take a look at any documentation that you may come across. It doesn't matter if you're the doctor or work in the front desk or the insurance department or maybe even the back therapy area. If you come across documentation that does not meet the minimum requirements for the history component and a 99203 has been billed, then reach out to your supervisor, make the doctor aware, reach out to the compliance officer, which should be documented in your office manual, and simply make them aware that the documentation that you see in front of you does not meet the history requirements for the detailed new patient office visit. It's about as simple as that. So we'll talk to you next week, and we'll be talking about the detailed exam requirements for 99203.